uptake. So at this stage, it is quite encouraging.
Right, to help me reflect on the outcomes of the Health Minister's briefing, I'm joined now by the Acting Deputy Vice-Chancellor for Research and Innovation at the University of KwaZulu-Natal, Professor Mosa Moshabela. Prof, good evening. Good to have you with us tonight. I guess at the heart of the briefing is to assure the nation that there are adequate vaccines for the rollout, particularly for the cohort that has now taken up this particular campaign. But, of course, the question becomes whether or not this is not as a result of stocks that have been there, and due to the lack of the uptake on the 60-plus cohort and maybe even the 34-plus cohort, we do have access. And should we be worried about the fact that that particular grouping didn't go to the vaccines as we had thought they would?
Good evening to Tabo and to the viewers. It's an important question of reflection that you're raising. And I think that, in fact, probably because of the increased demand, the minister has a duty to assure South Africans that they will not run out, especially people who are having to wait for the second dose. They may worry that, we now have more than 250,000 people a day taking vaccines. Am I not going to have my second dose? And I like the algorithm that the state is using, which kind of reserves the second doses for people that have to get a second dose. And I think that we need to be clear that anyone who's waiting for a second dose, their second dose would be protected, preserved, because it will be kept in stock to make sure that they get the second dose. So if we don't do that, then it might cause a little bit of panic for people, and they need to be assured that we won't run out. I don't think that it's so much the fact that there hasn't been uptake by other age groups, because in my view, the uptake by other age group improves with time. So if you look at the group that we started with, the 60 plus, they are now at 60% of uptake, and that's good. 6 in 10 people of 60 and above are vaccinated. If you look at the age group, that 50 to 59, they are more than 40%. And my view is that some people just need a little bit of time to basically get to it and then go and vaccinate. Yeah. And so I expect that even the 35 to 49, they will also improve in time. You start off with the most enthusiastic group, then it slows down a bit, they will improve. With the 18 to 34, we'll have the most enthusiastic group, then we have to find strategies to get the harder to reach part of those age groups. But I'm not concerned so much about the age groups in particular.
Part of those strategies are what's being interrogated by some of the MPs today in that briefing. For example, asking the question as to what have we done to engage the hesitant vaccinator, right? The ones who are asking questions, for example, around the efficacy levels, if they are lower now that we are dealing with the Delta variant, or are they still as effective as they were with the previous variant? Or those who are asking questions like, how come they came up with these vaccines so quickly when up until today there are certain diseases that we still don't have vaccines for? Are we going to those people and engaging them, or are we just merely saying, these are victims of fake news?
Okay, so a quick answer to that question would be to say that there are provinces that we've learned from that are basically using strategies that involve going out of clinics and hospitals into the communities. Limpopo, Eastern Cape, they've been ahead in terms of vaccination coverage because that's what they do. And they also happen to be more rural provinces that require unique strategies. But we are now seeing it in places like Gauteng, in Western Cape, and in KZN, where they are also even providing transport for people to get to vaccination sites. And I think that, the system is beginning to become more agile and adapt and acknowledge that there are people who need a little bit more help in terms of access. Now, once we have reached those people, which is the question you are now asking, some of them would be hesitant or undecided. My view is that the discussion around hesitancy and indecisiveness has shifted. If you look at the period before the vaccination rollout by the state, there was a lot more kind of hesitation, and the discussion was around myths. It was very much theoretical discussion. Now, what we are seeing is people who are sharing lived experiences themselves, people they know, and so forth. That's why people are concerned about deaths, they're concerned about side effects, and so forth. And so the conversation has shifted, but I feel like those people who are having to respond to these concerns may not necessarily be adapting their communication strategy and and keep up with the shift that is happening. Personally, Thabo, I think that what we are seeing now is people who are not so much concerned about the science anymore, but they're using the science to validate their existing concerns and fears at a personal level. At a population level, at a global level, they know the vaccines are working for most of them. But really, at a personal level, you might tell me that the risk is 1 in a million, but I might be that one. How am I going to be sure that I am not that one? So I think that's what we need to do.
Prof, let's leave it there for tonight. I appreciate your time. Professor Mosa Moshabela, who is the Acting Deputy Vice-Chancellor for Research and Innovation at the University of KwaZulu-Natal.